Occupational cancer is under-recognized and underestimated, but work-related diseases are on the rise, according to France Labrèche, a researcher in chemical and biological hazard prevention. Labrèche sat down with Canadian Occupational Safety to talk about what employers and employees can do to manage the risk.
You really have to be aware of all the situations. Lab technicians know they're working with dangerous substances. So they know that and they work properly to be able, and they have to do. We can't substitute some of the chemicals they're using. Same thing with the chemical industry. But then you can try and minimize the exposure as much as possible. Fumes like welding fumes, they contain all kinds of things, and some of them could be dangerous. Anything that burns can emit PAHs, polycyclic aromatic hydrocarbons, which can lead to increased rates of lung cancer and bladder cancer, for example.
The long latency period between the first exposure to a carcinogen and the diagnosis of a disease means employers and employees must rely on prevention to keep themselves safe.
So you really have to ask yourself questions about everything that you use or everything you're exposed to at work, even though you're almost sure that there's nothing there. Read the labels on the chemicals you're using. Read the safety data sheets. Try to sort of identify a list of all the things you're exposed to at work, and then try to prepare an action plan to do something about it. To manage them properly, to clean up the places where the chemicals, for example, are handled or stored. Whenever the situation is difficult, just go and ask an expert.
As for employers, there are a number of things they can do to improve the safety of the workplace by following the hierarchy of controls.
First, you eliminate the risk. And if not possible, you substitute it for something that's less dangerous. For example, there are several organizations that classify carcinogens as known carcinogen, probable, and then possible, and then unknown. So if you have a known carcinogen and you really have to substitute it, you can try and substitute it with something that's not, of course, or that's less potent, let's say. When you can't do that, try to use engineering controls. You enclose the whole process, for example. You avoid the workers to be exposed to it. And then if you can't do that, well, you try to shorten the exposure period, for example. And if you can't do that, then you provide protective equipment. But once you provide the protective equipment, you have to take care of the equipment. You have to make sure that it's used properly. You have to. So it's every step of the way needs work and needs to get involved in it and do it properly.